Hello everyone, I am myself Dr. Rajesh Gubba. In this particular short session, I'll be discussing the questions of the quiz which I have posted on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba, on 26th of April. So there are totally 5 questions. It takes hardly 10 to 15 minutes to discuss all these questions. So the first question is, a female aged 30 years presents with the episodic throbbing headache for past 4 years. It usually involves one half of the face and it is associated with nausea and vomiting. There is no aura. What is the most likely diagnosis in this patient? The options are classic migraine, common migraine, acephalic migraine, and then the brainstem migraine. Now, you see, the clinical picture which has been given is very much suggestive of migraine. So, what are the points in favor of migraine? Number one, middle-aged females. Next, the character of the headache, that is throbbing type of headache, usually involving one half of the face, and that is associated with nausea and vomiting. All these are the features suggestive of migraine, but there is no aura. So that is the reason why, what will be the answer to this question? The answer to this question is the common migraine. And what about the other options? If you take the classic migraine, it is the migraine which is associated with aura, and the most common form of aura is the visual aura, right? And what do you understand by the word acephalic migraine? Acephalic migraine is that it is the migraine without headache, or there will be mild headache, right? Or there will be mild headache. That is what is your acephalic migraine. Then without headache, what are the other features of acephalic migraine? I'll be discussing that in the next question. Then what do you understand by the word brainstem migraine? This is also called basilar migraine. So here, along with migraine, there will be presence of the brainstem symptoms, right? These brainstem symptoms, that includes mainly the giddiness, right? And the individual will not have a proper ability to stand as well. So that will be the brainstem migraine or basilar migraine. Along with migraine, there will be presence of the brainstem symptoms. So the answer to this question is the common migraine. Now you take the next question. Which of the following is least prominent in acephalic migraine? The options are nausea, vomiting, headache, and then vertigo. So we were just discussing in the previous question itself, the headache, it is least prominent symptom in the acephalic migraine. Then what are the features of acephalic migraine? Then nausea, vomiting, and as well as the vertigo. These are the features of the acephalic migraine, and the headache, it is the least prominent symptom in the acephalic migraine. Then the third question is, which of the following is true regarding the tension type headache? The options are, it may be associated with nausea and vomiting. Amitriptyline is the only approved drug for episodic tension type of headache. Tension is not an etiology. It is called as chronic when it occurs on daily or near daily basis. So if you see the question here, first of all, tension type of headache, it is a featureless headache, right? So nausea and vomiting will not be there in case of the tension type of headache. And you take this amitriptyline, it is approved for episodic tension headache. It is a wrong statement. This amitriptyline, it is used for chronic tension type of headache, right? So for chronic tension type of headache, we use this particular amitriptyline. Okay. Now, what do you understand by the word chronic tension type of headache? So chronic tension type of headache is that if the tension headache, it occurs more than 15 days per month, then we call it as the chronic tension type of headache. And remember, tension is not the etiology for the development of tension headache. So what the studies have shown that it need not be always. There is no clear evidence that tension is an etiology in case of the tension type of headache. So the correct statement is the C here. Now you see the next question. All of the following statements about the treatment of migraine are true, except, that is, which is the incorrect statement. Naratriptan has the slower onset and longer T half than sumatriptan. Second, rizatriptan is more efficacious than sumatriptan. Sumatriptan is selective 5-HT1B 1D agonist. Sumatriptan is used for chronic migraine. So which is the incorrect statement here? Sumatriptan, it is used in case of, or it is considered as the drug of choice for the acute attacks of migraine but not for the chronic migraine. And you take the other options. Naratriptan, yes, it has the slower onset of action and longer T-half than sumatriptan. That is the reason why it is not used in case of the acute attack of migraine. And rizatriptan is more efficacious than sumatriptan is correct statement. Then why don't we use rizatriptan for acute attack of migraine as the drug of choice? Because this particular rizatriptan is associated with the toxicities then compared to sumatriptan. That is the reason why sumatriptan is considered as the drug of choice. Okay. Then sumatriptan, what is its mechanism of action? The mechanism of action is it is a 5-HT1B1D agonist, which is a correct statement. So the incorrect statement is your fourth option, right? And the last question in the quiz is, which of the following statement is true about the temporal arteritis? The most common in the middle-aged males. Hemiparesis is an associated feature. Blindness is a preventable complication. Raised ESR is essential for the disease. So the question asked is the true statement. Remember, temporal arteritis, it is a large vessel vasculitis and it frequently involves extracranial carotid circulation, right? It involves extracranial carotid circulation. And what is the age group at which you see this very commonly is, it is not seen in middle age group, okay? It is the one which is seen in individuals more than 50 years. And it is very common in females rather than males. And if you take the average age at which you see this temporal arteritis, which is also called giant cell arteritis, is around 70 years. Now, hemiparesis is an associated feature is a wrong statement. Hemiparesis will not be seen in patients with the temporal arteritis. What is the important clinical feature in temporal arteritis? The important clinical feature will be the headache. And this particular headache, it will be a unilateral headache, right? And on examination, there will be tenderness of the temporal artery. Right, on examination, there will be tenderness of the temporal artery. Okay, that is what you will see in case of the temporal arteritis. Now, blindness, it is a preventable complication. It is a true statement. So, along with headache, the another important feature what these patients will develop is the blindness. Now, why is this particular blindness? That is due to the involvement of the ophthalmic artery. Right, that is due to the involvement of the ophthalmic artery and its branches. Okay, basically we call this as ischemic optic neuropathy in case of giant cell arteritis. And this blindness, it is a preventable complication. So how can you prevent the development of blindness is by giving prednisolone, right? By giving prednisolone. Okay, then raised ESR is essential for diagnosis. It is not always. See, raised ESR, yes, it is the feature of the temporal arteritis, but if the ESR is normal, then you cannot rule out the temporal arteritis. Very, very important. Okay. If the ESR is normal, you cannot rule out the temporal arteritis. That is the reason why investigation of choice in case of temporal arteritis will be temporal artery biopsy, which will be showing the granulomatous inflammation. And what will be the drug of choice for temporal arteritis? Drug of choice will be prednisolone. You have to give 80 milligrams of prednisolone and you have to give for nearly around 4 to 6 weeks. Okay, so that is about the headache of the temporal arteritis. So this completes the discussion of the questions which have been posted as quiz on my Telegram channel. So please follow my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba, for everyday quiz discussion. Thank you very much.